I'm an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. So welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodhi. This episode is everything you need to know about perimenopause. But before I get into it, the first thing I want to make very clear is that I'm not giving any kind of religious or medical advice. So if you have any concerns about your health, please speak to your medical provider. And if you have any questions about your religion, please ask your friendly neighborhood religious leader. It's the Muslim Sex Podcast because I just happen to be a Muslim woman who talks about sex. And today, guess who I have in the recording room with me? I have my sister, Rafia. Hi, Rafia.
Hi, Dr. Lodhi. I'm saying hi from North Carolina. What's going on?
Not too much. Thanks for joining me today. So we are going to have a lively discussion about perimenopause. So you ready to go?
Yeah, I'm ready to go, and I might be in perimenopause. We don't know. Let me find out.
All right. Me and you both. All right.
That's right. All right. I'm actually ready. So can I ask you, what is perimenopause?
Okay, yes. So perimenopause is a transitional period between when we are having regular periods. So for a woman that has like a regular 28 or 30 or whatever day cycle, to a woman that is no longer going to have any more periods. So that transitional period of where the periods become irregular. And that's usually the first sign that a woman is starting to go through perimenopause, are those irregular periods. So her periods could become longer or they could become shorter. She could go months without a period. She could have periods that are very short. She could have periods that are very long, heavy. She could be bleeding clots. So any of those things could happen during that time period of perimenopause. And that typically is what brings a woman to go see her gynecologist during that time, is when the periods become irregular.
So are there any causes for perimenopause, or it's just a natural transition?
Yeah. So, it's just something normal. And I think it needs to be really just celebrated, that a woman has made it this far in life, actually, to be honest. A lot of women may not be able to experience this because for whatever reason. But so this time in life is a normal occurrence. And it's just important that we see it as that. It's not a disease. Also what's going to be important is to see what's happening in your body at this time, right? What are you feeling? And emotionally, what you're going through, but also the other signs and symptoms of perimenopause are going to be like hot flashes, night sweats, mood swings. Some women may notice that they're increased irritability during this time. Some women may experience like forgetfulness, hard time concentrating. They may start to notice that they have dry skin more often. Some women may notice that they have a harder time with lubrication, with intercourse. They may notice that. So all of these things, can happen, and some women don't experience these. So it's really just dependent on the individual. But really, what's going on, and I think we're going to get into this a little bit, what happens and why does this happen?
So generally, how long does perimenopause last?
Yeah. So, perimenopause usually begins for women in their 40s and, mid to late 40s. And they say that perimenopause can last on average of 4 years. But for some women, it even lasts like 10 years, depending on when they start. Remembering that the mean age for somebody to go through menopause is between 51 and 52. So, depending on at what point in your life your periods become irregular, that'll decide how long this lasts for and how long this transition will be.
Okay. So, what are some of the symptoms of perimenopause?
Yeah. So, like we were talking about before, some women can experience like hot flashes, night sweats, mood
Yeah.
swings. Um,
Hmm.
Again, they may notice increased dryness.
Yeah.
They can have some sleep problems such as insomnia. Talked a little bit about the mood swings and about the periods becoming heavier, and
Hmm.
issues with lubrication. You may even notice some decreased libido, and all of these have to do with the decreasing estrogen in our bodies. And so that's typically why it happens.
Okay. So, can I just go to a doctor and can he diagnose this for me?
Yeah. So you mean she diagnosed it?
Oh, done. Yes. Yes.
I'm kidding.
Definitely
Yeah.
she.
You can have, right. We don't know if you have a male or female, but since your sister is the gynecologist. So, yeah, I mean, you can go. What happens is that typically they'll just go through your symptoms and see what symptoms you're having, and based on your age. And
Yeah.
that's a lot of times why how they're able to diagnose. But also what they may do is do check your hormones, right? So one of the first things that we check when we're trying to figure out whether or not somebody is starting to enter menopause is check her follicle stimulating hormone, FSH level.
Hmm.
And
Hmm.
that is a hormone that's released from a part of the brain called the pituitary gland. And that
Hmm.
hormone acts on the ovaries. So
Okay.
when we are no longer producing estrogen as much from the ovaries, that hormone that's coming from the brain will increase because it's constantly trying to pound on that ovary, trying to get it to
Hmm.
release estrogen. But when it doesn't do that, it just keeps trying and trying. And so that's why that hormone will be increased. And that is the hormone that we typically check for when we're seeing whether or not a woman is going through menopause. Um,
So, do you check family history, like siblings? Like, is that a factor too that
yeah,
we should consider?
Yeah, that's a great question, actually, Raf. So, a lot of times when patients ask me if they're going through perimenopause, I'll ask them, around what age, if they know, did their mother go through menopause, right?
Yeah.
So that
Hmm.
is a helpful hint. Now, sometimes women can have premature ovarian failure, which is, menopause before the age of 40. And yeah, so that's really rough on women because there's no way of them knowing that they're going to go through premature ovarian failure unless they're, say, like their mother or somebody went through that. But it's tough because in women that go through that, they may not have had a chance to, like, say, freeze their ovary, freeze their eggs or anything like that, and so they may not be able to conceive, which is very difficult, right?
That's hard. Yeah.
Yeah, definitely. And so,
Very hard.
but yeah, to your question about family history, absolutely.
Hmm.
So what I do is I always ask a woman, when her mother went through menopause, and maybe
Yeah.
when her siblings, right? Like, so if she has
Yeah.
any sisters, at what age they went through menopause, and remembering all the same, all the while that every woman is different. There is definitely some genetics to that, for sure.
Yeah. Genetics play definitely a role. So, can we treat it? Is there any way we can treat perimenopause?
Yeah. So, knowing that, perimenopause is not a disease, but typically what
Hmm.
we treat are the symptoms. So, if a woman is having hot flashes or night sweats, there's a medication called gabapentin that we use, and that medication is used for. Is an anti-seizure medication, but it tends to help
Yeah.
with hot flashes. And so
Okay.
women will be prescribed that sometimes if they feel like they need it, can be prescribed that to help with those hot flashes. Also, of course, depending on what symptoms you're having, if you're
Yeah.
feeling sadness, and sadness that progresses longer than 14 weeks,
Hmm.
and that, women are not able to function or, pursue their activities of daily living, then they may
Yeah.
be depressed. And so antidepressants would help with that. If they're having
Okay.
vaginal dryness, if they're noticing that that becomes a big problem, then
Mhm.
sometimes we can prescribe vaginal estrogen that'll help with that
Okay.
dryness. Also, lubricants, if they're having intercourse
Yeah.
and they notice that they're not able to become lubricated during intercourse, using a
Yeah.
lubricant such as KY jelly or any of those water based lubricants will help with intercourse. And so that
Mhm.
it's not as painful, right?
Yeah.
Um,
So
yeah,
just a question, like going through perimenopause, whatnot, can you get pregnant
yeah.
while on perimenopause?
While you're in perimenopause, yeah. So
Yeah.
actually, um, another good question because a lot of times women think that once their periods become irregular or if they are skipping months, right? Then they think like, well,
Mhm.
maybe I'm in menopause and I am not able to get pregnant, so I'll just have sex and not use any type of contraception, and that is definitely one of the biggest fallacies that people have during perimenopause because, yes, you can become pregnant. What happens is that although you may not be menstruating every month, you can still
Mhm.
ovulate during this time when you do have a
Okay.
period. Or prior to having a period, right? So you
Okay.
can, women are still ovulating. And even though they're ovulating irregularly, they're still ovulating. And so
Okay.
you can become pregnant. And so it's going to be very, very important to use some type of contraception. Women during
Mhm.
perimenopause can go
Mhm.
on birth control pills. And those birth control
Oh,
pills, even if they're low dose, will help prevent
yeah.
any type of unwanted pregnancy and will also help with those hot flashes, night sweats, mood swings, because it replaces that estrogen that they are losing.
Okay.
And so,
Mhm.
that is a good form of contraception. And also, another form of contraception that is often used is the Mirena or the progesterone only containing IUD.
Mhm.
And that
Mhm.
helps with heavy menstrual periods and,
Okay.
regulating the irregular cycles and is a great form of contraception.
So in perimenopause, your period still can be heavy?
Yes, yes. So some
Oh,
what's happening is that because you are not shedding. Remember, if your periods are irregular, so you're not
yeah.
having, you're not shedding that tissue every month. So that tissue is
Yeah.
actually still building up inside the
Oh,
uterus.
okay.
And so then
Yeah.
when you have a bleed, that bleed is
Mhm.
going to be very heavy because of all
Yeah.
that tissue that's built up inside of the uterus where you
Yeah.
weren't shedding it every month.
Mhm.
Yeah.
That's good to know because that's something, I didn't even think of, but then I'm like, can it be heavy? Yeah.
Yeah, absolutely. And that's one of the reasons why women will come to their doctor's office and seek help is because of those heavy menstrual cycles. Yeah.
So if when your symptoms are bad, does exercise help
Yeah.
to relieve
So
those symptoms?
the way that exercise helps is that one, it'll help with the mood, right?
Yeah.
So we
Yeah.
know that when um, we exercise, that dopamine is
Mhm.
released. Those hormones
Mhm.
that make us happy are released. And
Yeah.
so that's one of the best ways to counteract,
Mm.
some of the mood swings that we may have, some of the depression that we may experience during this time.
Yeah.
Exercise helps. Also, maintaining a normal, healthy body weight also will help
Okay.
because we know at this time, with that estrogen going down, women have a tendency to increase, have some weight gain. And
Okay.
so, maintaining a good, healthy exercise regimen is
Mhm.
going to help hopefully prevent some of that weight gain and along with
Mhm.
helping with mood. And,
Mhm.
also we know that when women tend to be heavier, their periods tend to be heavier because of the unopposed
Oh,
estrogen from the fat cells that we have in our body.
okay.
And so
Okay.
that's going to be really important in terms of trying to maintain not only a
Mhm.
healthy lifestyle, but also a healthy weight.
So, and I'm sure diet plays an important role in it as well to
Absolutely.
maintain a healthy diet. Yeah.
Yeah. Yeah. So, um, diet and foods that contain soy, right? Also help
Mhm. Mhm.
with sometimes they can help some women with their night sweats, their hot flashes, their mood swings, because the soy provides a form of estrogen that can help. And so a lot of women, when they're going through perimenopause, will drink soy milk, and that tends to help.
That's good to know.
Yeah.
I'm gonna have to load up on some soy milk now.
Yeah. So definitely soy helps. Also during this time, some women may find that, they may have urinary urgency. They may have to
Okay.
go to the bathroom more. And again, that's due to the effects of estrogen being lost. And so again, the vaginal estrogen creams can help with
Yeah.
that. But of course, anytime you have, urinary urgency, and if there's pain with urination, make sure that you go to your provider to make sure you don't have a bladder infection, right? We always want to rule out any type of symptoms that may, be the cause of a problem like a disease or something like that. Not that a UTI is a disease, but, an infection. We want to make sure we take care of anything that could cause a problem. So you want to make sure that you don't have anything else going on. And then as long as, everything has been ruled out in terms of infections, then, we can say that it may be just, maybe the loss of estrogen in the vagina.
Yeah. So if something doesn't feel normal, it's better to get it checked out versus just wait on it.
Yeah. Yeah, absolutely. Absolutely. Yep.
Yeah.
If you're having any symptoms or any type of issues,
Yeah.
always best to get it evaluated.
And not to skip those doctor appointments.
Yeah, definitely. Definitely. Yep.
That's why you're a doctor and I'm not.
Yep. And so, and again, in terms of taking some type of birth control pills, there's lots of choices. People have, women can go on the pills, they can take, there's still the birth control patch. There is an implant that you can put in the arm. There's the progesterone containing IUD. So definitely lots of options for women that may be experiencing, the irregular menstrual cycles. Definitely lots of options for women during that time. And also, I think something that had mentioned before was sexually transmitted diseases, right?
Yeah.
So really, really important that women that may not be in a monogamous relationship and that are sexually active and going through this time period in their life know that it's important that, they still use condoms or have their partner wear a condom, that so that they don't get exposed to sexually transmitted infections, right? And we talked a little bit about this in one of my other podcasts, but to use, have their partner use a latex condom and not the lambskin condoms, because the pores in the lambskin condoms still allow that bacteria to go through. And so that they, although that lambskin condom will prevent pregnancy, it will not protect against sexually transmitted infections, whereas latex condoms will. Yeah.
Okay. Protection is better. Got it.
So, okay. Well, I think that we are done here, and it's been real and really intimate. And remember, this is not meant to be any type of medical advice. So please see your healthcare provider if you have any concerns about your medical health. And until next time, this is the Muslim Sex Podcast.